For those of you that have worked with HIPRA before, you'll know we pride ourselves on supporting the preventative medicine aspect of animal health. Prevention is the future of a more productive, efficient, and ultimately welfare-friendly farming industry, an opinion I know will be shared by those of you that have signed in today, which is why HIPRA are proud to be one of the sponsors of the Dairy, Sheep and Goat Conference 2022. Now, whilst this is a pre-recorded presentation, I'd like to take a moment to remind you that one of our HIPRA technical service vets, me, Matt, will be in attendance should you have any questions. Equally, as usual, feel free to contact your local HIPRA rep after today if you want any further information on what we've discussed today or any of our other vaccines for that matter. Today we're going to take a moment of your time just to highlight our small ruminant vaccine range. We have Amoeba, our inactivated Chlamydia abortus and Salmonella abortus ovis vaccine, and Vimco, our sheep and goat mastitis vaccine that can be used to help control the impact staffs might be having on particular farms. So, despite years of vaccinating, enzootic abortion remains a major cause of abortion within the UK. The first thing I should highlight, something you may have already picked up on within our literature, is that whilst this is marketed as a chlamydia and salmonella abortion vaccine, the strain of salmonella covered by vaccination is abortus ovis, and this isn't something we currently seem to find in the UK. Instead, it's a much bigger issue in other parts of Europe. But what we do have is a very effective inactivated chlamydia vaccine, the only inactivated vaccine available in the UK. Because it's inactivated, we do need to administer a 2-dose startup followed by annual revaccination, but that inactivation does give us a little bit more flexibility in terms of the timings and when we can choose to use it. Because it's inactivated, we can demonstrate safety and efficacy during both lactation and pregnancy up to the last month of gestation. So should we, for example, need to treat animals that have already been served, maybe they were missed in terms of vaccination, maybe their status was simply unknown because they were purchased after they were already in lamb, we have that option available to us. The inactivation process doesn't compromise vaccine performance either, and this is just an example of some of the material that we have highlighting the reduction of abortions, but also the subsequent control of pathogen shedding. Now, of course, today's few slides were never meant to be a masterclass on abortion control in small ruminants, but hopefully this has been a useful reminder on how and when Amoeba might be a useful addition to your enzootic abortion control. An even bigger challenge is to try and talk about small ruminant mastitis control within just a few slides. But again, this is just here as a reminder as to where Vimco could play a role on farm. The incidence of clinical mastitis is variable, but usually sits around 5 to 7% per year. The trouble is, for every clinical case picked up, we're likely to see more extensive subclinical case levels on farm, and in fact subclinical infections have been reported to affect up to 50% of a flock. Now, we can't afford to underestimate the impact these cases can have, and that's a hard discussion to have on farm. But due to the elevated somatic cell count, subclinical mastitis has been shown to result in reduced milk quality and quantity. In fact, up to about a 15% reduction in milk volume. In a commercial meat flock, as I say, we have to try and rely on lamb growth rates to highlight this, and it can be quite challenging. But within the dairy sector, where hopefully we've got more cell count and information and ability to monitor things, these differences might be more noticeable. Thankfully, our ability to investigate and control mastitis in small ruminant dairy setups, as well as the economic results of doing so, should promote valuable discussion. We've got a great deal more data available for us to interpret, whether that's on its own or in conjunction with pathogen culture results, but ultimately we're trying to pattern spot, trying to identify key changes that would make the biggest difference. And really that's feeding into creating a control plan tailored and specific to that farm. Once we've got that thought process engaged, we can come back and ask the question, could Vimco be used to help further that mastitis control? It's important that we kind of highlight that this is an addition to mastitis control, not a substitution, and we do exactly the same thing where we're talking about our dairy cow mastitis vaccination range. But for the right farm, it can really help turn the tides of mastitis control. This is, of course, so long as the pathogen profile fits, and we would always advise, always encourage getting some up-to-date cultures just to make sure that Vimco is going to be a worthwhile investment. So when we consider pathogen involvement in both goat and sheep, staffs typically account for about 60% of clinical cases and more than 70% of subclinical cases. Of course, not the only pathogen involved, that's why we would always advise checking. What staffs? Well, Staph aureus predominantly when we're considering clinical cases, but then we're looking more towards our coagulase negative staffs when we're thinking about those more abundant subclinical cases. Now these kind of results do seem to be reflected in the farms we've worked with, though I think we should all be encouraging more frequent milk sample submissions to try and help improve the reliability of this kind of data within the UK. So finally, how could Vimco help on farm? Well, alongside other aspects of mastitis control, we can help bring down the number of subclinical cases. Fewer udder lesions, reduced somatic cell counts will in turn help lessen the impact these subclinical cases can have on milk production performance. We'd hope to see a 50% reduction in clinical cases and a subsequent reduction in the number of deaths and replacements needed to maintain the population. And of course, when we're all trying to reduce the amount of antibiotics being used unnecessarily, vaccination can help bring that antibiotic usage down by 30%. So vaccinating a farm with Vimco is certainly an investment, but when we start looking at some of these features, it's an investment that can really help pay off in terms of mastitis control and return of investment. On-label vaccination does require 2 doses at the end of gestation to maximise protection at what is often considered the higher risk early stages of lactation. So we're looking at timing doses pre-lambing, first being 5 weeks pre-lambing, the second 3 weeks later or 2 weeks pre-lambing. And this should be repeated each subsequent lactation, though of course we're happy to discuss any dosing or protocol queries you might have to get the right fit for each farm. So thank you for your time, everyone. As I said, I am in attendance today should you have any further questions. Equally, you know where your HIPRA reps are. We're always happy to help. Thank you.